A very good afternoon to all of you. This is Fatima Kalkatawala and I shall be moderating today's session. On behalf of the Applied Nutrition and Dietetics Department of Sister Nivedita University, I welcome you all to today's webinar, A Virus Gone Viral. 4 days ago, on the 10th of July, the field of microbiology and genetic engineering experienced an irreparable loss on the demise of Professor Ananda Mohan Chakraborty, whose work revolutionized the world of microbiology patents. He was the first one to artificially create an infinitely powerful bacterium that could prevent oil pollution in the ocean. May your soul rest in peace, sir. I would request all of you to observe a minute of silence in the memory of Professor Ananda Mohan Chakraborty. Kindly mute your microphones, audience. Thank you, everyone. In the present day scenario, while there is a lot of awareness regarding how we can boost our immunity to keep coronavirus at bay, it is not always the medicine cabinet that holds the solution to this. Going by the nutritionists and dietitians, the key could be right in your herb garden at home and in your diet. Today we have with us an eminent speaker, Ms. Paramita Das Datta from the Department of Dietetics of Chittaranjan National Cancer Institute in Kolkata. She has been working over there for the last 23 years. She is Secretary of International College of Nutrition, Calcutta Chapter ICN, and the Founder Secretary of Society for Nutrition and Dietetics, SND. Ma'am has played a pivotal role in developing the present dietary system of the Institute by outsourcing cooked food for the first time among Kolkata hospitals. I would request all participants to mute their microphones and turn off their videos. Kindly put forward your questions to the speaker in the chat box. Those who are viewing the live streaming, please feel free to mail your questions to the email address provided in the registration confirmation mail. I would now request our Honorable Vice Chancellor, Sir Professor Dhrubajyoti Chattopadhyay, to deliver the welcome address.
Thank you, Fatima. Good afternoon to everybody. Good afternoon, Paramita, our speaker today. And we are all actually looking forward to hear from you about the exciting topic you have mentioned already. The only thing I just want to mention that considering the scenario, the pandemic situation, and the way the government of India is moving towards, it is a very, very important challenge that how we are going to put forward policy decisions regarding number of things, including the nutrition, and how this nutrition plays a very important role in bringing up our immunity and other. So in this context, the establishment of undergraduate courses in nutrition is a very important step of Sister Nivedita University. And I'm very happy that it's already been started, and we are looking forward to the help of the eminent dietitian and the nutritionist of our state, country, as well as international, so that we can build up a very strong department. So thank you all the participants, and let us wait for what we could hear from Paramita. Thank you.
Thank you, sir. So, ma'am, we would now request you to deliver the talk. Ma'am, we'll share the slides with you on the screen.
Thank you, Dr. Chattopadhyay. At the outset, I would like to thank Dr. Dr. Chattopadhyay, for giving me this opportunity to speak on such a uh, good platform. And in the new normal, which we are calling the new normal, uh, these online webinars are a way forward. So now I will start my talk of today, a virus gone viral. I would just come back to this weird topic in a few minutes. Uh, but to start off with, I would like to just jog your memories and mine too at that by just recapitulating a few basics. Next, please. Yeah. So what are viruses? Viruses are tiny segments of nucleic acids with a lipoprotein coating that are usually only a few nanometers wide, but have the ability to cause massive havoc within a short period of time in both plants and animals. In fact, viruses are so pathogenic that they often infect other microorganisms, such as bacteria in the form of bacteriophages. Next, please. Okay, so this is the diagram of the coronavirus. This has a similar structure to a normal virus with showing spikes to form a crown-like structure like the solar corona, hence the name of coronavirus. Interestingly, viruses are likely to thrive uh, and kept alive if the host is kept alive. This means that the virus survives as a result of coexistence with the host, and this relationship contributes to its spread. So it's a complex relationship between the host and the virus. At times, viruses mutate to evade immune responses, but this may lead to the synthesis of deadly variants that ultimately kill the host. Furthermore, viral infections involve a relatively long latency period, like like this SARS-CoV virus, COVID-2 virus, which has a latency period of almost 14 days before the symptomatic stage, which is why this virus is so deadly. Viruses can also employ several mechanisms uh, that are referred to as facile transmission. This facile means easy in French. It allows the virus to spread even at an acutely early stage of infection, as in case of the SARS-CoV-2 virus. Despite being such a great risk to our health, designing a therapeutic approaches towards rendering them inactive is very complicated. Viral infections are hard to treat because the viruses replicate by integrating their genome into the host's chromosomal DNA. And therefore, it's challenging to target the virus using drugs without damaging the patient's cells. So antiviral agents that have been developed either to reduce the rate of viral infection, viral replication, or to antagonize the binding of the viruses to their receptors. So that is how the antiviral agents work. So in line to the old adage, prevention is better than cure for all viral infections. And finding vaccines against viruses seem to be the only definitive way to conclusively counter these microbes. Next. So the viruses are not new. We have seen several episodes of pivotal episodes in human history. They bring fear and at the same time fascinate humankind. Viruses represent important forces of population control and natural selection for all living organisms. Before the media was taken over by this SARS-CoV-2 epidemic, other viruses were responsible for the deaths of millions of people just in the past century, like the smallpox, the Spanish flu, and the measles epidemics. Besides Assuaging the ongoing burden of viral diseases, the knowledge of virus and their environment is key to improved biology techniques. Virus helps us better understand human evolution and create alternate ways with dealing other pathogenic microorganisms like the multi-resistant bacteria, the cells and the cells they infect. Such information can be used to find cures against other diseases such as cancer and other NCDs. Next. Now, just a few words about the history of coronaviruses. We are seeing beta coronavirus zoonotic outbreaks since 2002 with the first outbreak of SARS-CoV, the SARS coronavirus, and then in 2012 the MERS coronavirus, and now the recent outbreak of SARS coronavirus 2 late in 2019, also named as COVID-19, which we are more used to, and the novel coronavirus 2019 or nCoV 2019. Next. Now, to come back to my choice of today's topic. See, the first coronavirus case was detected in December 31st in China, in Wuhan, in China. And on 9th January, first death was reported again from China. And in the next 93 days, we have seen the world reach 1 million cases. So the rise of every first 2,500 population, 250,000 population was infected in 80 days. And the next 250,000 was in the next 6 days. And then the next in 4 days and next in 3 days. So total 93 days took us to reach 1 million total affected population. So you can understand how viral it is. Like a clip on your phone goes viral, a WhatsApp message goes viral. This virus has also gone viral. Next, please. Now I would share with you a few important dates in the flow of events of COVID-19. Just to reiterate my point that how deadly this virus is. 8th December, there were 41 cases with pneumonia-like symptoms reported in Wuhan. 31st December, the first confirmed case in China. 1st January, Wuhan seafood market was closed, which was thought to be the epicenter of the spread of the disease. 30th January, first case of coronavirus was reported in India, in Kerala. 30th January, WHO 2020, WHO declares public health emergency in global concern. Then 2nd February, first death reported outside China in Philippines. 11th February 2020, the disease was named COVID-19. Virus named SARS-CoV-2. 14th February, death was reported outside China in Japan without any travel history to China. So it has started its spread in the society. 16th February, first death reported in Europe, in France. 10th March, first death reported in India. 11th March, WHO declared COVID-19 as a global pandemic. And today, on 14th July, the Ministry of Health and Family Welfare has confirmed a total number of 906,752 cases, 571,460 recoveries, and 23,727 deaths in our country. India is currently the largest number of confirmed cases in Asia and has the third highest number of confirmed cases in the world. So you can understand with the turn of events that how fast it is growing, and we are looking at a really, really big issue in the coming months, and it is nowhere. Even today, the WHO declared, the director of WHO declared that it is not going to go away just at the blink of an eye. We have to learn to live with it. And what better ways than to fall back on our own house and our own kitchens. For next slide, please. Okay, so this is a few clippings of before clipping. Excuse me, someone is excuse me. Hello, can you
I
hear
would
me?
request our participants to mute the microphones.
Okay, so these are a few clippings of how the outbreak in India is going out of proportions day by day. So, and we are looking at positive COVID, the cases in mostly in the metro cities of our country, and the more concentrated in the metros. Maharashtra leading, then Gujarat, then Tamil Nadu, and then all the cities, all the major cities, Mumbai, Ahmedabad, Chennai, Bangalore, Kolkata. These are the hubs of coronavirus today. Next, please. Now, this is a picture at the center is the Wuhan seafood market. I've tried to show you the outside view and the inside view, and the bat and the pangolin and two different types of snakes, which are actually given the are being given the major cause of this disease. And so next, please. But unlike other foodborne gastrointestinal viruses, these are SARS-CoV-2 is not a gastrointestinal virus. It is not making people ill through contaminated food, but through person-to-person contact and through respiratory droplets, which can be airborne if an infected person coughs or sneezes in the air, and this is airborne transmission or through droplet nuclei, and it's not reported as any foodborne illness. Next, please. So according to WHO and other public health organizations, there is no evidence that the coronavirus can be transmitted through food or food packaging for that matter. However, recent studies concluded that the coronavirus 19 can be can survive on different surfaces for up to 3 days or even more in certain conditions. Under specific conditions such as of temperature, relative humidity, and light, it can even maintain. It can remain viable for a very long period of time. In very cold climates, even for 2 years. So WHO, through International Food Safety Authorities Network, is investigating the potential for persistence of COVID-19 virus on foods and other potential role of in food transmission of the role of food in the transmission of the virus. So the transmission of COVID-19 virus can also happen through contact with contaminated surfaces. When people touch these contaminated surfaces with contaminated hands, and then they touch their own nose and mouth or eyes, therefore they can spread the disease by touching. But it is not a direct contamination of food. It is just a relative contamination of through the food handlers. Okay, next, please. So it may be possible that people can get COVID-19 by touching surfaces or objects that has virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Next. Now, outdoor air can carry up from 200 to 1,500 bacteria and viruses per cubic meter. So understanding the importance of temperature, humidity, and air filtration are the keys to combating the disease at the moment. Like AC environment, where the confined there is confined air, in a small space, which is shared, if shared by a contaminated person, can contaminate all the others who are sharing that same space. Next, please. Now, according to WHO, the COVID-19 virus causes respiratory diseases in humans, like if the droplets are airborne and or it is settled on certain surfaces, and then it is through the nose, mouth, or eyes of a person goes into the system of a human being, it directly affects the lungs and the pharynx, and thus contaminating that person, and the virus spreads. And the most important part is the patient may be asymptomatic for quite a few days, where the latency period of the virus before the symptoms are shown in that person. So then it becomes really difficult to know which person is affected and which person is not. And it depends on the immune system of that particular person, how far the person can combat the virus. Next, please. So now I will move on to the links between coronavirus, nutrition, and our immune system. So next. Now, turbocharge the immune system. What is turbocharge? Some gadgets these days use this term turbocharge, which charges in at the blink of your eye. It is so fast. So you can just put it onto the plug and it gets charged. But the truth is more subtle. As highlighted recently by the WHO, that healthy lifestyle makes all bodily functions work better, including the immunity. So there is no turbocharge of the immune system. Having a healthy diet, including lots of fruits, vegetables, is the key component of a healthy lifestyle and plays a vital role in supporting a well-functioning and effective immune system to help protect against infection and other diseases. Next, please. Now, how does the immune system work? It is one of the most complex bodily functions and made up of network of cells, molecules, tissues, organs, all working together to protect our body. This complexity means that it cannot be modified acutely by a specific nutritional intervention. You cannot just take one shot of one medicine-like thing and you start feeling better, your immunity levels go high. It's not that. Rather, adhering to a healthy diet provides ongoing support to the immune system and may even delay the process of immunosenescence as we grow older. Next, please. Now, can nutrition boost our immune system? A very, very important published statement by the British Dietetic Association I would like to share with you, quote unquote, simply put, you cannot boost your immune system through diet, and no specific food or supplement can prevent you from catching COVID-19 or coronavirus. Good hygiene practice remains the best means of avoiding the infection. This is a position statement published by the BDA recently to reiterate the fact that on one fine day, you just cannot change your immune system. Next, please. Now, but I would like to again come back to immunonutrition. There are ways and means which you can use to boost your immune system. If not overnight, but then you can, if you have not already started, you can just start today, right now. So there are many nutrients that are involved in the normal functioning of the immune system, which is like copper, folate, iron, selenium, zinc, vitamins A, B6, B12, C, D. These are helping the functioning of the immune system. But we can all get all these together in a balanced diet. There is no other option but to have a balanced diet. There is no one food, one particular food like a vitamin A supplement or a B supplement, or iron, zinc, selenium supplements, which can give you the benefits of a balanced diet. You need to have a healthy, balanced diet. The immunoprotection of many of these nutrients are based on their antioxidant capacity, and which is lost if it is consumed in excess. So popping a pill is not the answer. It is important to consult a registered dietitian before making any significant changes in your diet. So immunonutrition is helpful, but you need to go by the micro doses of, or because these are all micronutrients which are required in very, very minute amounts by us. So if you go in excess, its antioxidant capacity is lost. Next, please. Now, these are some guidances which by which you can protect your immune system. Being a healthy weight, being physically active, eating whole grains, fruits, vegetables, and beans. I might sound very repetitive in my next slides, but it is. I would keep on harping about the same things over and over again, just to make the point that you need a regular, healthy lifestyle throughout your life. It's like brushing your teeth every day morning, and going through your regular schedule of work, going to your exercise, and going to your workplace, or studying every day. It's not it, you cannot just boost your immune system in one day. And you need to limit fast foods, limiting red and processed meat, limiting sugar sweetened drinks, limiting alcohol consumption, limiting avoiding smoking, getting enough sleep, and particularly for COVID-19, you need to follow the hygiene rules. Next, please. So an important step that can be taken is right in the kitchen. Strengthening the natural immune system with a diet dense in proteins, vitamins, minerals, and other nutrients found in whole unprocessed foods. You need to look into it that your diet, your plate is full with, and it looks like an ideal plate, which has some amount of carbs, some quite a good amount of dairy, some fish, lots of vegetables, greens, and other colored vegetables, and of course water. You need water also to have a good system. Next. That, like as the saying goes, Rome was not built in a day. So maintaining a healthy immune system should be the priority of all individuals throughout their life, like maintaining weight, muscle mass, and even dental health. But if it hasn't been the case, if you haven't started yet, right now is a good time to start. Next, please. Now, a very important area which is coming up in recent times is the immunity, COVID-19, diet, and obesity. Next. The COVID-19 pandemic is presenting unprecedented challenges around the world. Apart from the health risks of coronavirus, apart from the health risk, apart from the food we eat, the way we work, like today's webinar wouldn't have been on an online platform if it wouldn't have been for COVID-19. I would have probably talking to you face to face on auditorium, but we have a new normal now, and we cannot escape the fact. So we have been changed, impacted in ways hardly imaginable only a few months ago. As time goes by, we are learning more and more about COVID-19, and it's now becoming clear that people with certain health conditions, like we are from day one in West Bengal, especially, we are hearing about comorbidities as the death cause of COVID-19 patients. So what are these comorbidities? These are diabetes, respiratory diseases, heart diseases, cancer, kidney diseases, and they are more likely to cause severe symptoms in than a normal patient of COVID-19. Unfortunately, they are more likely to die from the infection. Many of these conditions are non-communicable diseases and chronic illnesses which are linked to diet and lifestyle, and of course, obesity. Next. Now, recent reports have suggested that obesity is one of the underlying health conditions that can cause more severe reaction to COVID-19 infection. This is ever more significant given that India faces the dual burden of overnutrition as well as undernutrition, with an ever increasing number of overweight, obese adults in both the urban and the rural scenario. And indeed, worldwide, around 1.9 billion adults are living with overweight and obesity. Given these extremely high rates of obesity around the globe, it is possible the pandemic could disproportionately impact those who are overweight or obese. Next. So there have been various suggestions to why excess weight could increase severity of COVID-19 symptoms. Few of them are like stored fat leads to high levels of inflammation. That is proved over years, decades of scientific research. So which can reduce the effectiveness of our immune system, which can be the one reason. It is also possible that fat stored around the middle of the body, that is central obesity, which is a very, very common thing in the Southeast Asian population specifically, could make the lungs less efficient in the face of viral infection. Reports have been coming in the population of USA. The maximum number of deaths are among the blacks, then next the Hispanics, and next the Indians who are living in, the Asians who are living in America. So this can be a possible reason, the central obesity can be a possible reason that they are being affected so much. The evidence on obesity and COVID-19 is new and it's still emerging, and the picture will become clearer in the next coming days, months, even years it can take. Next. So we already know that obesity and overweight increases the risk of at least 12 different types of cancers, NCDs, evidence that is based on decades of research from around the world. While obesity is not something that can be changed overnight, a healthy lifestyle that includes having a healthy diet and being physically active will not only lower your risk of cancer, NCDs, but also ensure the immune system is working at its best. Evidence shows that people who follow healthy dietary recommendations are less likely to develop NCDs and maintain healthy weight. Next. Now, some long-term impact of COVID and obesity. Unfortunately, the lockdown, which was introduced in many countries to slow the spread of the disease, and it was probably for the good of us only, but it has made it very hard for people to have healthy lifestyles. It can be harder than ever to stay active while you're confined at home. The temptation of snacking is more when at home. Using the lockdown period, people are inundated. We are all inundated with posts of food being cooked and gourmet food being cooked at home. Since people have a lot of time at hand, and therefore they are eating more, they're cooking more. And when we are also feeling a lot of stress under these new normal situations, we don't know what is going to happen tomorrow. So stress often leads people to have unhealthy diets. But we need to take this up as an opportunity and not see it as a hindrance. Like being at home, we can be with the children. It is a good opportunity to cultivate healthy habits in ourselves and our children. And a greater awareness can be built of good nutrition and importance of physical activity in everybody around you. Some useful tips are staying active during the lockdown. You can go for a walk in your terrace. You can go for a walk in if you have a veranda space, or even in your rooms. You can move from one room to another. You can entertain children. Children are a source of good exercise also for adults. Looking after pets, cultivating other hobbies, so that your mind is not in on food. You don't feel like eating, or you're not feeling hungry always. So you need to take your mind away from food. Next, please. Uh, so living with overweight uh, and obesity, I've already mentioned that it increases the risk of NCD. So healthy, balanced diet is vital for good health, especially so during and after infection. A healthy diet along with physical activity is key to maintaining a healthy immune system. There is also evidence to show that people affected by obesity can have an impaired immune response or immune function, making them more vulnerable to infections. Not only does a healthy diet provide ongoing support to the immune system, obesity management and maintaining healthy weight can help a person lead a disease-free life. So, during this time of lockdown, if a person is overweight or obese, or even in the unlocked periods, overweight and obese people can start today to maintain their actual weights, actual ideal body weights. You should all aspire to maintain the ideal body weights. Next, please. Now, some wider consequences of COVID-19. Mostly these measures like the lockdown and unlock 1, unlock 2, we are going through unlock 2 now. So all these uh, habits are you know are probably for all these intended for our good, but there are unintended consequences that are affecting our diet and physical activity levels. This often affects the poorest and all vulnerable population disproportionately due to the lack of access to quality, affordable, healthy foods. So in the pandemic, uh, it has caused food supply disruptions, stockpiling, production issues, and spikes in food prices, which has, uh, and also we have also in West Bengal seen the Ampan right during the lockdown period, and which has not helped anybody during the lockdown period, and we are affected furthermore because of the dual effects of the COVID-19 plus the Ampan. And now again we are facing in a lot of places we are facing rains, and there are news coming in for people getting waterlogged and what not. The North Bengal is already facing a lot of problems. So this has impacted our food supply chains, food sources. So we are maybe in some time in the future we may look into a famine like situation. So we have to be in readiness of every situation in the coming months. This has led to an increased reliance, or our reliance on highly processed foods, long shelf life foods. We are, a lot of people I've heard are living on Maggie. If I may quote the quote actually a product name which I shouldn't have, but people are uh, just relying on comfort foods during this stressful times. So this is not helping us at all. We are moving towards calorie-rich foods, and has we have reduced access, especially the older people who stay alone in our society. They do not have access to fresh fruits and vegetables. So it is impacting in a this will have wider consequences. In addition, nutrition-specific community measures are designed to address problems of malnutrition, might be suspended to focus all health resources to COVID-19. Now, our only focus is how to uh, reduce mortality, reduce morbidity from COVID-19. So all our other, uh, uh, community specific nutrition measures, nutrition policies have taken a back seat. So that is going to impact, if not now, in coming times. Next, please. Okay, all these changes can contribute to weight gain during the pandemic, the long-term effects of which can have an impact throughout the life course, starting, for example, with the suspension of number of different health services and maternal health services, midday meal services. Schools are closed, so people are not getting the midday meal services, which are probably in our country, it is a very, very important community nutrition service, wherein at least one meal was served at school levels to growing adolescent children. And this was a very, very good initiative uh, to save them from malnutrition. And obviously, if they do not get that protein amount and that good balanced food from the schools, they are probably having only rice and maybe dal, or may not be dal, and potatoes and things like that. So it is not giving them wholesome nutrition. So for children having been breastfed, we all know this, that it reduces the risk of being overweight in childhood or adulthood and decreasing their risks of many NCDs in later life. So we are going to face a lot of wider consequences. Next, please. Now, there are also health risks due to reduced physical activity. Physical activity is, we are confined. How and where do we do the physical activity? And increased sedentary behavior due to movement restrictions and also physical distancing measures. In America, I'd like to give you a statistics that the streaming platforms grew by, time spent on the streaming platforms grew by 34% in the first 2 weeks of March. It increased the minutes of the week, minutes spent on internet usage, raised by 40 billion in these first 2 weeks, 40 billion minutes. So worldwide expert panels have found strong evidence that greater screen time is a convincing cause of weight gain, overweight and obesity in children. This is an issue exacerbated in the current crisis. It is increasing. The screen time also increases the exposure to advertisements, which research shows affects the dietary intake of children. And people are more moving towards taking supplements, popping pills. So this is how some are obviously maybe stuck inside with no access to any gardens or any outdoor spaces. Some may be living in very, very small spaces. So the only method which can help them is possibly some active video games or exercise videos might be which they can follow and practice regularly, or yoga practices. I would like to say that yoga is a very good indoor exercise practices. So it can give you a good amount of physical exercise even when you're confined or living in a containment zone. Even during the lockdown times, maybe even living in a containment zone in a very small cooped up space. So it is best to start physical activity and physical exercise. Next, please. Now, again, almost at the risk of being repetitive, I will share with you some basic nutrition advice during the COVID-19 outbreak. Next, please. Eat fresh, unprocessed foods as much as possible every day to get the vitamins, minerals, dietary fiber, proteins, and antioxidants from your fresh food. Regular inclusion of dairy and fish and fresh vegetables in your diet is a must specifically during the COVID-19 outbreak. Next. Now, eat moderate amounts of fat. You can follow any of the international guidelines. The ADA guideline says about 30 grams of visible fat that has to come from all three types of fat, that is the saturated fat, monounsaturated fat, and polyunsaturated fat in a ratio of 1:1:1, which is the ideal situation. So if you are having lots of fried foods, it is time to cut down on those fried foods. It will significantly lower your risk of overweight, obesity, heart disease, stroke, diabetes. Everything can be linked to these lifestyle disorders. Next, please. So eat less salt and sugar. So these are two things which we get in abundance from all the natural foods which we take. We just add salt and sugar in our diet for we just add salt and sugar in our diet because we enhance the taste of our food. Excuse me, I have lost the video presentation. I have lost the presentation.
Rajat sir, can you present once again?
So,
Yes, I'm.
So when cooking and preparing food, we can limit our salt and other sodium condiments like soy sauce is a very high salt containing condiment. So I'm probably on the 36th slide, I think. Yes, that one. Yeah. Okay, so so you can limit your daily salt intake to less than 5 grams. That is 1 teaspoonful of salt. And if there is a method of how you can limit your salt intake, that is by not taking too many different items at all at the same time, and limiting table salt, absolutely limiting table salt intake. So that way you can contain your salt intake to 5 grams, 1 teaspoon of salt per day. And sugar is also not a good additive in our diet, which is empty calories and does not give you any benefit whatsoever excepting the taste. So you limit your intake of soft drinks, sodas, and other drinks that are high in sugar content, and instead have fresh fruit juices and yogurts and things like that. So you can choose fresh fruits instead of any sugary foods or fried foods when snacking. So fresh fruits and salads, which will give you a much better healthy lifestyle. Next. And avoiding eating out. Anyways, during the lockdown period, there were no restaurants which were open, so we had to eat inside. But now with the unlock 1 and unlock 2 era, we have open access to food delivery systems, and a lot of people are taking food prepared by the fast food chains. So it is best avoided during this time when your physical activity levels is also reduced. Next, please. Now, another very important issue I would like to touch upon is counseling and psychosocial support. While proper nutrition and hydration improves health and immunity, these are not magic bullets. People living with chronic illnesses who have suspected or confirmed COVID-19 may need support with their mental health, and they are under a lot of stress. And every day you can see there are especially in India, there are a lot of other issues which are related to there is a social stigma attached to it, and so it's really very big psychosocial issue, and people would need support. So seek counseling and support from appropriately trained healthcare professionals. And also there are a lot of community-based uh, counselors, some NGOs that are providing help and relief to these people. So we now must seek professional help. Next. Okay, now just I would like to just point out a few uh, very important vitamins and minerals which have a major role in our immune system. Vitamin A maintains the mucosal lining of the respiratory and GI tracts to protect against infection. Also strengthens and the adaptive immune system to fight invasive viruses and bacteria. Vitamin B6 supports numerous biochemical reactions that help you to fight fight infection. Has a wide range. Vitamin C has a wide range of impact on the immune system, including the activity of T lymphocytes, which recruit and coordinate the body's disease-fighting cells, and phagocytes, which engulf and destroy the foreign invaders. Next. Now, vitamin D, it regulates the innate and adaptive immune system to quickly identify and destroy the pathogens that enter our body. Zinc develops and activates T lymphocytes when taken at the first stage of illness. Zinc prevents cold viruses from binding and replicating in the mucous membrane of the nose. And I would like to share a few food sources like shellfish, which we normally ask people not to take, like the crabs, lobsters, shrimps, etc. They are very rich in zinc, and different meats, red meats also are rich in zinc. Spinach, cashews, pumpkin, squash, and sesame seeds. All these seeds are very rich, and dark chocolate. So that's silver lining. So if you have some amount of dark chocolate every day, that can take care of your zinc requirements. Next, another very important thing which I have to focus on is the probiotics. Healthy human intestine supports some 10 trillion microorganisms, which not only break down particles of food, but also dangerous bacteria, virus, germs, and fungi. So keeping a healthy bacteria balance in your gut prevents pathogens from entering the bloodstream. So probiotics is a must in everyday life, and yogurt is the best solution at our hand, which can be easily made at home. And other cultured vegetables like unpasteurized fermented vegetables, like which we don't normally eat a lot, but even the South Indian delicacies like dosas and uttapams and idlis are pasteurized forms, so they do provide you some amount of probiotics. Also some soft cheeses and pickles are good sources of probiotics in our diet, regular diet. Next, please. Now, some seasonings and spices which are in focus these days is garlic. These contains a lot of organosulfur compounds, saponins, phenolic compounds, etc. Allicin, which is a bioactive ingredient in garlic, increases the cold and flu fighting response of certain white blood cells. So allicin is better absorbed when the garlic clove is crushed or chewed raw rather than cooked. So we always, but even if it is cooked, it is put in everyday cooking, it does have an effect. It's not that it is, it is always better absorbed in the raw form. Onions have quercetin, and which is an antiviral and histamine regulating antioxidant. Next. Next, please. Yeah. Ginger has a powerful antibacterial, antiviral, and anti-inflammatory compounds, and they target the stuffy nose. In our Ayurveda, we have always heard, and when we were children, We were given on a sore throat, we were always given raw ginger to be kept in the mouth and chewed for the juices. It keeps rhinoviruses from binding to cells in the mucous membranes. So it is a very powerful antibacterial, antiviral, and anti-inflammatory compound. Turmeric, which contains curcumin, is a compound widely known as for its anti-inflammatory properties, and research has also shown that it has ability to support and modulate the immune system. Next. Now, protein. Why is protein essential in our in maintaining the immune system during these COVID times? Protein is broken down, which we consume is broken down by our digestive system into amino acids, which are then reassembled into proteins the body needs to function, including antibody formation of antibodies and complement proteins that support our immune system. So it is very vital that we take our daily dose of 0.8 gram per kg ideal body weight to 1 gram per kg ideal body weight worth of proteins in our daily routine. Next. Now, hydration. Water plays a very, very important role in flushing out the toxins from our body. It also has a critical role in production of blood and lymph and carries all the nutrients and pathogen fighting cells from the thymus and bone marrow into every cell of our body. I think again I have lost the slide.
No, actually, one of the participants has started presenting by mistake. Vidisha, I think we would request you to start presenting.
Okay, so water, like I was talking about, water is also critical in maintaining our colon health. And most important pathway is our colon for elimination of toxins and waste. If toxins are allowed to accumulate in our body, then the healthy bacteria will die and unhealthy microorganisms will grow. So, and studies have shown that 80 to 90% of all diseases are directly or indirectly related to gut health. So, the most vital is our maintaining our gut health and importance of hydration. We need to drink at least 8 to 10 glasses of water every day to maintain a hydrated, good, well hydrated body and a hydrated gut. Next. Now, some general guidelines during the COVID outbreak. Next. Now, coronavirus are very stable at low temperatures. They can even survive up to 2 years at a minus 20 degrees centigrade temperature. So it can survive on frozen food products. So it is advisable to avoid frozen food products at the given point of time. But the silver lining is coronaviruses are susceptible to high temperatures, about 70 degrees centigrade, and also humidity. Also, coronaviruses are susceptible to the most common cleaning and disinfecting agents and procedures. So that's the silver lining for us. So we must clean and sanitize. And to reiterate, clean and sanitize. Next, please. Now, all food contact surfaces such as utensils, cutting boards, servingware must be washed, rinsed, and sanitized often throughout the day. But be sure the dishes are properly washed and sanitized after every use. Non-food contact surfaces that are touched, like tables, the kitchen counters, the gas stoves, need to be also thoroughly cleaned and sanitized. Next. Now, how does food become unsafe? I've already mentioned that it is not a foodborne illness. But how does food become unsafe? How it is through food handlers who, if not, food is not handled correctly by the food handlers, it can become unsafe. The five most common mistakes which we often make is purchasing food from unsafe sources, falling to uh, failing to cook food correctly at the correct temperatures, holding food at incorrect temperatures, and the perishable foods are not, has to be put in refrigerated conditions or even freezers. Using contaminated equipment. If a surface which is contaminated with the virus is used again, it can contaminate the food, and the food, since we intake the food through the mouth, then of course it will contaminate the person as well. Practicing poor personal hygiene, not washing hands properly and not washing it often, and see, these are all very old hygienic practices which we all always learned to follow throughout our life, as now we are again starting to learn it once all over again. So food is best not to be cooked by the sick. This is also another important. If somebody is feeling sick, especially if showing symptoms, it is best to avoid preparing food for other people and even for themselves. So that can contaminate others further. Next. And now I have been talking about all the bad points, the risk factors, now a ray of hope. Next. Now, the emergence of novel coronavirus that has claimed a significant number of lives in the last few months, and within a very short period of time, it has necessitated the utilization of new vaccine development protocols with aim of curbing the alarming pandemic. This has been witnessed by a race to obtain an effective vaccine against the virus since it was first reported last year in China. The rapid research and formulation of potential vaccines may prove to be a pivotal step in the eradication of viral infections in the near future. With the urgency that has come with finding a vaccine quickly against the COVID-19 virus, the FDA has allowed phase 1 trials of this vaccine without any animal data, so which will possibly uh, fast forward the vaccine development process. Next, please. So this is a picture of Ms. Jennifer Heller, who volunteered to receive one of the first mRNA vaccines against the novel coronavirus as a human clinical trials begin. Next, please. So we expect a virus, antivirus very soon as a vaccine. Now, our food systems are seeing a sea change in the era of COVID-19, the pandemic crisis. So a lot of bioactive ingredients, like I was talking about the garlic, the ginger, the onions, and the turmeric uh, has come out as supporting human health and developing their immunity. Food security has come out as a big important issue for population who is under lockdown, or even those the migrant laborers who are coming over from places they used to work for. A lot of people has lost their jobs in this pandemic situation, and food security has become of a important issue, a vital issue for us. And the food safety within the pandemic crisis is also another issue which I have already discussed in details. And the sustainability of the food systems in this new era is also a new challenge. Next, please. So we need to ensure that populations continue to access and consume healthy diets and can be physically active during the pandemic. Recognize that the food systems and health systems are intrinsically linked. If a person is given food which is only carbohydrates, he cannot have a healthy life. He is bound to fall prey to obesity and other malnutrition. Ensuring healthy and affordable food is available for all. Continuing advancing obesity and NCD prevention policies that are in the process of development. We should not leave that. And we are now concentrating all our thoughts and resources onto COVID-19, but we must follow all these other issues as well. Encourage food and drink industry to offer healthy and affordable food. Run campaigns to promote healthy food preparations and preparations and consumption. Maintaining surveillance on policies and industry actions that may undermine access to healthy diets, and ensure that policies relating to healthy diets are still enforced and the regulations are not exploited. Tackle misinformation. This is one very, very important issue I would like to uh, 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 underline upon, is about COVID-19, and promote the importance of high quality and trustworthy news sources, especially around diet, nutrition, and physical activity. Almost everybody has their own say about diet and nutrition, and also physical activity for that matter per se. So the misinformation has to be tackled, and it is upon us, the nutrition faculty and the nutrition fraternity, to disseminate proper good information to the general masses. Deliver mass communication campaigns and messaging on how to remain physically active whilst physically distancing. So the issue of healthy diet and the issue of being physically active remains in focus for the upcoming times. Next, please. So we need to prioritize our health promoting food policies. Before the pandemic, we already had a global epidemic of overweight and obesity. Government could be presented with a ticking health time bomb of rising overweight and obesity rates and a greater burden of disease once the pandemic subsides, if healthy diets and physical activity are not prioritized. So it is upon us to make ourselves, even if we ourselves change our own personal health status and our family's health status, it is a step forward. Indeed, this pandemic could provide a pivotal moment to refocus on prevention. It is always better than cure. Reshape our policy towards prevention and increase action to reduce rising rates of obesity and overweight. To achieve this, we urge governments to, as soon as viable, take a long-term view and promote affordable, accessible, healthy foods to all. Adopt a comprehensive approach in policy making to ensure policy coherence between food and health. Need to ensure food security as well as food safety. Promote increased physical activity and seek international cooperation and policy coherence between food policies and health. Next. Now, this is my last slide. For the take-home messages, that proper nutrition and hydration are vital. Good nutrition supports the body throughout your life course, from birth to old age. A balanced diet, including all food groups, supports an effective immune system and may provide protection against infections and other chronic diseases. The best part of how nutrition can boost the immune system is that we have complete control over what we put in our bodies and the bodies of our kids. It's important to learn about preventive measures and way to maintain a powerful immune system. And that is all from my side. And now I would like to take the questions from you.
Thank you very much, ma'am, for the informative presentation. I'm sure the audience have gained a lot after hearing your talk today. Ma'am, we have lots of questions coming up from the audience.
Yeah, but let me tell Paramita, you really covered such a huge variety of things in such a 1 hour time. This is really nice. Only one thing I just want to know, that what about the role of micronutrients?
So, sir, I already mentioned all the vitamins.
Yes, the zinc and others, but right now it's coming up some new ideas about these micronutrients. a combination.
Yes, it is coming up, but it is yet to be, we are not yet using these combination as a therapy as yet. So it is
Okay.
still in the process where we can apply it to our patients. So that
Yeah.
is why I did not mention it
Okay.
yet. It is
Yeah,
on the,
because you know that
uh,
Facebook and other places you can see every day so many
so
different suggestions.
yes,
I know zinc is always there, and but
yes,
now it's so many different combinations they are now mentioning. So
yes, a
thank you.
lot of, even
Mhm.
even some recent things have come up regarding arsenic as well, sir.
Arsenic, yeah,
So
yes.
which we all know to be very, very
Yes, toxic.
toxic, and we have already heard, we only heard about arsenic toxicity, and
Yes.
now we are hearing about the
Yeah.
benefits of arsenic. So
Yeah.
uh, so that's why I avoid
You
it
try to avoid that.
in
Okay. Thank you,
particular.
Paravita.
Thank you, sir.
Thank you
Thank
for
you.
the nice talk. Yeah.
Ma'am, one of our faculty members, Professor Shom Shubhra Thakur Chaudhary, he has a question. Like as you
Okay.
mentioned in your talk about the beneficial effects of vitamin C, and even many physicians they're recommending vitamin C tablets. So he's asking, is there any side effect to the consumption of high amount of vitamin C?
Like I mentioned, all these vitamins, like not, I wouldn't say vitamin C has got a very big side effect, because it is normally flushed out. If it is not required by us, it is flushed out. But it has a added burden on our flush out systems, the kidneys. So it is better, and the minute amounts you need are enough for maintaining your good health. If you are having variety of foodstuffs, if you are having regular intake of lots of colored fruits and vegetables in your diet, and citrus fruits, or even any seasonal fruit for that matter, you can have your dosage of vitamin C regular, which is required by a normal healthy human being. But if you're affected by the disease, or you're facing coughs and colds, or you're prone to cough and cold, so then it is actually good to have a supplementation of one vitamin C tablet in a. It's best used in a chewable form.
Mhm. Thank you, ma'am. Ma'am, then the next question is Professor Milan Banek from the Department of Microbiology and Biotechnology of our university. Ma'am, he wants to know that how hypertension in a patient is directly related to the respiratory failure during COVID-19.
Uh, it may not be, like, it is not really the purview of my lecture today, but I would like to share what I know. Hypertension is a comorbid condition wherein, or there is a chance of other conditions, other comorbidities already present in your body, like the uh, abnormalities in your lipid profile, and maybe a risk of CVD, and obviously obesity and overweight is linked to hypertension. So it is not only hypertension, but the other allied aspects of different, because these are all, we call it syndrome X: obesity, hypertension, CVD, strokes, diabetes. These are all linked together in a cyclic fashion.
Right. Ma'am, then Debashri Sadhu, she's asking what kind of diet are useful for weaned babies?
Weaned babies.
Yes. What kind of
In what situation? Is it during the COVID, or is that baby a patient of COVID, or uh, since I think we will restrict our discussion to COVID-19, and
hmm.
if the baby is a COVID-19 positive, babies have a very high recovery rate. So
Ma'am,
you
she's
need
saying
not.
during COVID only. Ma'am, she's saying during COVID.
Okay, during COVID, if the patient, if the baby is having COVID, and the normal weaning food which the baby is used to, not deviating from, if he's already weaned, So the normal weaning food which he is used to take has to be given to the baby according to his requirements, has to be given. And if the baby is serious, if he is not taking food by mouth, it's impossible to feed him by mouth, then the baby has to be given liquids. Go back to your liquid feeding of the baby with which he is already used to. Like if he's used to mother's milk, then mother's milk. If he's used to cow milk, then cow milk. Whatever he had been taking previous to being affected by COVID.
Ma'am, Farheen Sultana is asking, can we use stevia instead of sugar?
Stevia is an artificial sweetener, though it is a most natural of the sweeteners, but we don't know. It is not, as of now, we have not found any toxic or adverse effects of stevia. But if possible, we should stick to the natural sugars which are present in our daily food and not go for any of the artificial sweeteners, if possible. In abroad, when the child is born, they are disallowed to give the child any kind of added salt or sugar. So the baby is used to the taste of natural foods, which we probably do wrongly here in our society, that we from the very beginning we add sugar in the milk of the baby, which is not required. Milk has got its own sugars, which has got its own taste, and salt and sugar is just in our taste buds and nothing else.
And then Urjana Ganguly, she is asking, how can an asymptomatic person understand or take measures for COVID-19? Means if a person
That is where the challenge lies. That is where we are. That is why we are. The virus has become viral. That is when the person is, when he's asymptomatic, and the first 3 days before he develops any kind of symptom are the maximum phase when he spreads the disease. So that is the maximum time when he can spread the disease. So he can, everybody, for himself and for the next person, everybody must follow wearing masks, follow wearing for hand sanitizing and hand washing protocols, and maintaining personal hygiene. That is the only, and coughing and sneezing etiquettes have to be maintained. So these are the only protocols for protection of a person who is affected or not affected, symptomatic or asymptomatic.
And the next question is from Professor Rajat Pal of our university. He's asking, can nutrition and diet of an individual be related to the psychological strength in addition to physical strength?
I would say it does, because if you are having a lot of good foodstuffs, your physical well-being is related to your mental well-being always. And if you are having good food, and if you are having good nutrition, you are not sick. You're obviously, you feel at a better mental state than any other person who is not having a good food or a nutritional state, because you feel well, you feel happy. So this, and in a positive frame of mind, this makes your and as you know, eating is one very, very important way of feeling good. So a lot of people who are mentally depressed often tend to eat a lot of junk food just to feel good. So eating has a feel good factor. So if you're eating well, you can have a if you have a mental well-being. It is related, if not directly, but indirectly.
Ma'am, if you have time, can we take a few more questions?
Okay, yes, I have time.
Okay, ma'am. The next question is from Aishwarya Nair. She's asking, is cognitive restructuring a better method to divert our mind from the stressful situations happening around us?
See, it's again another area which is not really in the purview of my talk. It is totally a psychological orientation. But if you can divert your mind to some other constructive work, it always is better. Like if you are doing some, especially some creative activities, have often shown lot of research has been done on creative activities like painting or listening to music or even practicing music in some form or the other, have given you a better diversion from other stressful conditions. So that might help.
And then Dr. Saurav Kumar, he's asking, Madam, nowadays younger people are affected more than the elderly. Even in some cases, death occurs. So what is the reason behind the death of these young people more often? And please suggest those people who every day spend the time outside the home for 12 to 16 hours, what they should do.
To answer his first question, that why younger people are getting affected more and the mortality rates are higher in these younger people is yet to be, we are yet to get any kind of conclusive information about it. As it is, the mortality rate in India is about 6%, varying from 4 to 6% in the country. So, and we have not yet got enough data to say that younger people are getting more affected or older people are getting more affected. But in India alone, we have seen that age group bracket in a very kind of unhealthy lifestyles. Most of them are obese, having central obesity, or they have a comorbidity which they do not uh, which they have not. They are thinking that, okay, I'm so young, what can I have? We are seeing a lot of young diabetics, we are seeing a lot of young heart attacks. So maybe that is another one reason of seeing this younger population of our country being affected by COVID-19. And what was his second question?
Yes, ma'am, what are the precautions which should be taken for
Okay.
those people who are 12 to 16 hours outside, working outside?
So they have to carry their own food, make sure they eat in a place where it is not contaminated, make sure they follow the hand hygiene and regularly sanitize or wash their hands uh, every now and then, and continuously, not even for once, take off their masks, never use tobacco or smoke in public places, and like to have tobacco or smoke, you need to take off your mask and use the proper ways and methods to wear the mask and take off the mask, and regularly clean their uh, dress, whatever they're wearing, and their masks every day. And then wait, sun dry their masks. If they're reusing their masks, sun dry their masks for at least 48 hours in a hot sun, so that way they can reuse their masks. And basically avoid eating out, carry food from home as much as possible. Even if they're buying food like fruits and all that from outside vendors, they must clean it with good quality uh, bleaches, or diluted bleaches can be a good cleaning agent for if they're eating outside their homes. They will have to if they are staying outdoors for 12 to 16 hours.
Ma'am, just two more questions. One is from Shawnee Shaha. She's asking, there is a risk of COVID in AC. So now in many places, people are not allowing to, means they're not switching on the AC in fear of COVID. But as COVID is airborne, so is it safe to travel by a car by keeping the window open?
So if you are not, it's a droplet infection. Like I mentioned earlier, it is a droplet infection. And it can spread from one place to another by coughing or sneezing of a contaminated person. So if you are coming in contact with another person who is contaminated, then you can get affected if you are traveling in a car or a public transport. So that is why the importance of wearing masks always in public places. If you're wearing a mask, it is not directly going into your nose and mouth. And wearing a mask is also very, like, we are seeing a lot of people wearing masks, but mostly they are hiding their chin, or they're at least keeping their nose out a little bit, which is not the correct way of wearing a mask. You have to wear it properly to cover your uh, uh, nose and your mouth, and also preferably wear a headgear, a cap, when you're going outside, so that the hair does not come in contact with your eyes or your mouth or get inside your nose, which can be contaminated from someone else. And you do not put your, even while taking off the mask, you need to first take off from behind your ears, or if it is tied from behind, and do not hold any part of your mask which is actually covering your face. So that is the actual way of using a mask. So that is the only way of prevention.
Now, and the last question is from Suparna Mandal. She's asking, is there any risk factor for a person with PCOS for COVID-19 infection? And what precautions should be taken for people with PCOS?
See, PCOS is also a problem related to COVID-19, but then COVID-19 being primarily a respiratory problem, which primarily attacks your lungs. People with PCOS, if they are not hugely overweight or morbidly obese, they need not worry about the infection. If they get infected, then as a comorbid condition, they will be more at risk if they get the infection. But if they can prevent the infection, prevent from getting the infection by following the regular norms of safety, so then it is not at all worrying.
Thank you, ma'am. Ma'am,
Thank you very much.
Yes, ma'am, there are plenty of more questions. We'll take them up through mail. So, ma'am, I would request Professor Rajat Pal now to address ma'am and deliver the vote of thanks. He's the head of the Department of Microbiology and Biotechnology at Sister Nivedita University.
Thank you, Dr. Kalkatawala. I would like to thank at the very beginning Dr. Paramita Dasdatta for such a very nice presentation and such an informative talk. I'm really grateful to have her in this webinar. So, and as told in her lecture that if it would not be a pandemic situation, she might come to our university campus and she will she would give the lecture in our conference hall. So I would like to, get the privilege to say, ma'am, that definitely that will be done. And I expect that we will have you on our campus in our seminar hall to present another lecture after this pandemic situation. So thank you, ma'am, very much for giving us the time and solving the queries of so many participants as well as from us also. Next, I would like to thank our Honorable Vice Chancellor, Professor Subhajyoti Chattopadhyay. Without his, tremendous effort and support, we cannot, be able to do this kind of, organize this kind of webinars. Always he stands beside us and supporting us. So very much thank you, sir, to you. I would like to thank Dr. Fatima Kalkatawala and Dr. Shamshukur Thakur Chaudhary also for, make this event success, for giving tremendous support behind this. And I would like to thank the other faculty members of our department, like Dr. Milan Bonik and Dr. Ashley Ghosh, for with us throughout the presentation and preparation of this webinar. I would like to thank all the participants who are present over here, who have been through the webinar, who has actually made this event successful. So I thank you all on the behalf of our Department of Microbiology and Biotechnology and Applied Nutrition of the Sister Nivedita University. I will definitely expect all of you to see, in person at our university, at our campus, the beautiful campus of Sister Nivedita University. Thank you. Over to you, Fatima Kalkatawala.
Thank you, ma'am, for being with us and spending valuable time with us. We look forward to meeting you in the university in the near future.
Thank you so much.